on hernia. Okay, so I'm going to do the pre-op management for hernia as well. Any type of pre-op operative care plan, you are going to use this for it. All right, it's not just mainly specific for that hernia. All right, so I'm going to use it for any pre-op care plan. Okay, so we are going to start with, I actually wrote some things out so avoid forgetting any. All right, so we are going to start from nursing problem. All right, so you know, when I was doing that assessments, hernia assessments for John, I were able to identify one nursing problem. Number one of it, I mean, it's two nursing problem. So the first one is pain. You know, John was complaining of pain on the right side of the abdomen, right? So we are going to do care plan for pain as well as for preparedness for theater. All right, and another one that is very common with pre-operative care is anxiety. All right, so let's start with pain. All right, thank you. Make sure you are touching the subscription bell. All right, touch the bell, follow me, comment, and share it to all the nurses that is preparing for their examination. Even the nurses that are still in the school, they still need this nursing problem care plan to be able to pass their nursing council examination. All right, I love you guys. So let's dive into the main thing of the day. Okay, so we have that John is experiencing right-sided abdominal pain, okay, with a pain score of 5 out of 10. All right, and then our aim is that John is going to verbalize reduced pain with a pain score less than 3 out of pain after nursing intervention. Okay, and then our re-evaluation day is going to be today, 10/2/2025, every 30 minutes, and as clinical condition changes. All right, okay, and then we now move to e-matter read. All right, so the first one is going to be explain all aspects of care to John and gain consent for all the nursing intervention. Let me come again. Explain all aspects of nursing care to John and gain consent for all aspects of nursing care. All right, then the second one in matter is M. Monitor John's vital signs or observation every hourly. All right, and then as per new score of 0. We know we got a new score of 0 on that particular assessment we did. If it's a new score of 0, that means we are meant to monitor these patients every 12 hourly. Okay, and as clinical condition changes. Let me come again. Monitor John's vital observation every 12 hourly. Okay, but you know that this patient is going into for theater. Is pre-op, so we are not going to monitor these patients 12 hourly. You understand what I mean? If it's just ordinary let me say homelessness or what is it called again, any other care plan, we can use that. But as long as pre-op is concerned, you are going to say at least every 30 minutes or to 1 hourly. Okay, as per new score of what you got. All right, and then escalates to the nurse in charge and the doctor with proper documentation. Okay, all right, and then the next one under e-matter read is assess John's level of pain using universal pain assessment scale. All right, using universal pain assessment scale, and then escalates accordingly. Okay, because it will not be nice that you assess the pain and you are not escalating it except if there is no pain. All right, Okay, and then under A matter read, next one is going to be T. Then you teach John techniques to relieve pain, or teach John pain relief techniques such as deep breathing exercise and diversional therapy. Okay, A matter read. All right, another teaching should be teach John the indication and side effects of his medication. All right, you know you are going to do a medication, I mean implementation later. While you are doing that medication, remember you are teaching John the indication and the side effects. You remember that, so put it here on every planning. Make sure you are putting under teaching, teach John side effects and indication of his prescribed do medication. Okay, then after you have teach that medication, you can now administer do prescribed medication. If you get me, yeah, we are getting there. Administer do prescribe medication. All right, I'm taking it slowly so that the first timer and every other person can be able to pick the points they need to pass their examination when it comes to planning. All right, okay, so the next one we are going to do, after you must have teach that medication and the indication, you are now going to administer do prescribe medication. If you remember vividly, when you are doing your implementation, it's only medication that is due on your time is what you are going to administer. All right, so now you administer do prescribe medication and assess its effectiveness after 30 minutes of administration. All right, and then you are going to refer John to surgical team and medical team because he is preparing for surgery. All right, on his consent, refer John to surgical team and medical team with his consent. All right, then after that, under A matter read, inform John to use call bell, and then remember to ensure that that call bell is at his reach. Inform John to use call bell and then make sure is at his reach. Okay, next one is proper documentation. D, E matter read is proper documentation. Document all care rendered to John or document all nursing care given to John with dates, time, and signature. Good, that is it. Do you see how I make it easy for you to understand pain management? Pre-op pain management. Okay, all right. So how do you see it? Is easier for you, right? You can actually understand it slowly and gradually. Okay, just take your time, watch this video over and over again. You are going to understand it very well and it's going to stick on your brain. Okay, you know, when you are more doing something frequently, you tend to understand it more and then assimilate it more. I wish you best of luck in your examination. God's chooks love you. Thank you. So the next one now is going to be, next one we have here is theater preparedness. Yes, the next nursing program is going to be self preparedness for theater. Right, so let me put it very well on the way you are going to. So guys, the second one under this planning, okay, pre-op planning, is let me read it how I wrote it out. Okay, John is for theater and needs self preparation for theater. John is for theater and he needs self preparation for theater. Okay, Now, the second one here is that John will be prepared for theater, will be self-prepared for theater after nursing intervention. Okay, John will be readily prepared, or you can say self-prepared for theater after nursing intervention. All right. Okay, under re-evaluation day, to be re-evaluated today, 10/2/2025, every hourly and as clinical condition changes. Okay, then immaturate will now come in. All right, so we have explained all aspects of nursing care to John, and then gain consent for all the nursing intervention. Remember that. Okay, and then the next one is going to be monitor John's vital sign or monitor John's vital observation every hourly as per new score of, you say what you get on your new score, and then escalate according to NISTU policy. That is it. All right, and then next one is going to be assess John's readiness for theater and ensure proper documentation. All right, next point is going to be under immaturate is teach Johns to be on new pay oral 6 to 8 hours prior to surgery. Very important. This is to avoid aspiration. Okay, teach John to be on new pay oral 6 to 8 hourly prior to surgery. All right, and then the next one under T is going to ensure that consent form is signed by John. Yes, you as a nurse, before surgery, you are going to ensure that consent form is signed after the doctor or the surgeon must have explained the procedure to the John. He is going to sign it willingly. You will be as a witness there. All right, so ensure the consent form is signed by John. All right, okay, and then the next one under T is measure John's leg size for third stockings. Measure John's leg size for third stockings to prevent thromboembolism. All right, that is blood clotting. All right. Next one under T, remember what I told you earlier under T. Teach John his medication and side effects of that medication. Teach John's indication and side effects of his medication. All right, and then you are not going to administer that medication. Yeah, then prescribe medication to John, or administer John's prescribe medication. All right, after you must have teach John the indication and side effects of his prescribed medication. You are not going to administer John prescribe medication and then monitor its effectiveness after 30 minutes of administration. All right, guys, don't mind my book, my baby tore it. Okay. Okay, so next one is going to be, after you must have administered that medication, you now remember to refer John to surgical team because he is for surgery. You are referring John to surgical team. All right, good. And then the next one, sorry there, remember, refer John to surgical team with his consent. Yes, you have to get his consent and then refer him to surgical team. Okay, and then the next one is going to be inform John to use call bell, or inform John to make use of the call bell, all right, and ensure that the call bell is at his reach. Let me come again. Inform John to make use of call bell and ensure is at his reach. Good. All right. Now, the next one is going to be documentation. Remember that if you do all these things without documenting it, you have not actually done that procedure. You get me? Yes, you have not done it. Okay. So, document all aspects of nursing care rendered to John with time, date, and signature. Good, that is it. Remember, okay? So, guys, do you see how easy it is? Just tell me, do you see how easy this planning is? Yes. I make it easy for you. Yeah, okay. Make sure you are touching down subscription bell. Ensure you subscribe to this channel. Make sure you watch all the video, share it to your friends, that is nurses, students, nurse, and those that are preparing for their examination. All right, I got you. Okay, so another one under pre-op is anxiety. Guys, this is common to all the pre-op procedure planning, I mean to say. Yeah, whenever someone is going for surgery, you are going to be anxious. It's normal. You don't tell me that you are going to surgery, you are dancing. You are not somehow feeling, oh my God, how will it be? Will I be able to come out? What will happen? As a normal human being, you be anxious, you be asking questions, you can't just be, ooh, I'm going to surgery. No. I don't think it's possible. Yeah. Although sometimes you be happy, maybe you want to go and give birth, but that anxiety will still be there. It's normal. Remember that, okay? All right. And then if you're nursing when you are doing your planning and the question paper they gave you says that she is not experiencing any form of anxiety, then you can read it over and do another one. All right. So I'm giving you 3 options: pain, theater preparedness, and then anxiety. Okay, so guys, the next one is anxiety. Okay, John is experiencing anxiety due to surgery. Good, yeah, that is it. John is experiencing anxiety due to surgery. Yeah, because he's actually going to surgery, and that is why he is experiencing anxiety. All right. Okay, next one is going to be under the M. John will show no signs of anxiety after nursing intervention. After nursing intervention. Remember to use SMART while doing your planning. SMART while doing your planning. Okay, good. And then next one you are going to use, the evaluation day is going to be John will be re-evaluated today 10/2/2025 every 30 minutes to hourly and as clinical condition changes. Or you can say that John will be re-evaluated today every hourly and as clinical condition changes. Okay, all right. And then the next one is going to be under red. All right, we are using red for this planning. Okay, so we are going to say monitor, sorry darling, explain all aspects of care to John. Explain all aspects of nursing care. The one that is related to you is what you are going to explain. Explain all aspects of nursing care to John, and then get consent for all the nursing intervention. All right. Okay, and then the second one is Monitor John's vital observation or monitor John's vital signs at Spain News 2, news score of 1 or 2, depending on what you got. And then escalate according to News 2 policy. Monitor John's vital sign at Spain News 2, news score of 2 or news score of 1 according to News 2 policy, and escalate according to News 2 policy. All right, sorry guys, I'm a little bit distracted. Okay, and then the next one is going to be matter. We have to and then this one is assessment. Yes, assess John's level of anxiety using numerical mood scale. Assess John's level of anxiety using numerical mood scale. Good. All right, and then the next one after assessment is okay guys, so after assessment of anxiety, okay, the next one is going to be under matter read is teaching. You teach the patient the techniques to relieve the anxiety. Okay, teach Mr. John the techniques to relieve anxiety. All right, such as deep breathing exercise and diversional therapy and positive imaginary. All right, okay, after you must have teach that, then the next point is going to be under matter read is teach. Still use another T. It's supposed to be A, but I advise you to use another T, which is also to teach patient the indication and side effects of his medication. All right, teach Mr. John his indication and side effects of his medication, and then administer do prescribed medication and monitor its effectiveness after 30 minutes of administration. All right, okay, after you must administer the medication now, and then the next one is to refer John to surgical management team for expert care. All right, and then another point is going to be after you must have referred the patient under e-material is I inform John to use call bell or inform John to make use of the call bell. All right, and ensure is at his reach. Inform John to make use of call bell and ensure is at his reach. Okay, and then the next one, remember, if you have not documented it, you have not done that procedure. Okay, is documentation. All right, so now document all care rendered to John with time, date, and signature, or with time, date, and sign. Good, that is it. You are done. Okay, that is pre-op care plan. All right, how many did we solve today? We have talked about the pain, we talk about anxiety, we talk about self-preparedness for theater. All right, so that is it. We are done for pre-op. All right, darling, so make use of the button down there. Make sure you are subscribing on that button. Okay, follow me, like, comment, and share to students, nurses, and also nurses. Okay, thank you so much for being there, staying for a longer time, because I know this video is long, but it's going to help you. Trust me, this video is going to help you. All right, okay, thank you so much for watching. Love you.